Welcome to Scrubbed In and Speaking Out, the podcast from the Registered Nurses Union Newfoundland and Labrador. In our first season, we've been having some important conversations about what nurses are experiencing on the ground, from professional practice to workload to workplace violence. And what we're hearing is clear. Nurses are working in environments under significant pressure and in situations that can impact not only patient care, but their own safety and well-being. Today, we're going to talk about occupational health and safety and what that means in today's healthcare system. Because safety in healthcare isn't just about one issue. It's about all these factors together. It's workload, it's staffing, it's workplace violence, and the systems that are in place to support nurses and all other healthcare workers. Joining me today is Ashley Hunt. Ashley is our research and education specialist here with the Registered Nurses Union. Ashley, thank you for being here.
Thanks for having me.
So to ground this conversation, how should we think about occupational health and safety in nursing today, not just in terms of the physical risks, but all the factors that shape nurses in today's world and their safety at work?
When we talk about occupational health and safety in nursing today, we really want to drive home that it extends beyond the physical environment. When we think of occupational health and safety concerns, we do need to include things like fatigue, workplace violence, psychological safety, as well as, infectious disease hazards and, dealing with hazardous materials and medications and other things that affect nursing safety or potentially put nurses at risk. So again, it's not just the trips and falls. It's not just the physical environment. It extends far beyond that. And I think we need to drive that message home that it's not just nursing safety that is at risk when we look at these hazards, is also patient safety that's impacted.
Absolutely. And as you mentioned, the importance of recognizing safety is in a broader sense, and not just a physical, but the overall work environment that nurses are practicing in. So we've also been talking in previous episodes about professional practice and the importance of documenting when things are unsafe. How does that connect to occupational health and safety?
Yeah, so we, spoke at length about professional practice reporting and how underreporting is a big concern for us with our members. That extends into the occupational health and safety field as well. Mm-hmm. We do hear verbatim that, our nurses are experiencing occupational health and safety risks at work in terms of, workplace violence, psychological stress, harassment, as well as, the physical environment risk factors. But when we speak with, higher ups in NLHS and we speak with people that are involved on that side, the employer tells us that they don't get the same kind of reports about those things that we hear. So there is, a trend in underreporting, and it's not just in professional practice, but also in occupational health and safety. But we need to remind nurses that they have, every employee has 3 rights. We all have those rights across the board. That's legislated. We have a right to participate in decisions that affect the safety of them and their work. They have a right to know about known risks in the workplace or potential risks. And they have the right to refuse unsafe work. So reporting any kind of hazards that they're experiencing is very important in order to ensure that it's addressed. And it really provides, again, that record that we need. If it's not written, it's not done. Mm-hmm. So we need to kind of have that electronic or paper trail to show both the employer and the union that these are the issues that our members are experiencing and that affect their safety.
And we're hearing that. Even at the Health Sector Safety Tripartite Council that we have with NLHS and Workplace NL, it is widely recognized that we do have a huge amount of underreporting in the healthcare system when it comes to reporting occupational health and safety issues. Yeah. And one part of that is when a registered nurse or nurse practitioner or healthcare professional files a claim with Workplace NL, they then have a decreased salary. Yeah. And we're seeing it in increased sick leave usage. so as the employer is seeing it in the stats, and government does have the stats with the increased sick leave. But therein lies the issue, because with the lack of reporting, we're not getting the issues fixed in the workplace either, right?
Yeah.
Because, like
we don't
you
have the
said,
evidence.
not charted, not
Yeah.
done, right?
And that's, the documentation being key is obviously something that we've been trying to drive home with all these podcasts that we're doing. But getting at the underlying, I guess, reason of the lack of reporting is really important too. And we do know that in general, there is a kind of nonchalance about, oh, well, nothing's going to change and, nothing's happening because, again, things like fatigue or, burnout related to working short that impact the environment and put nurses at risk. There is kind of a common belief that documenting about that is not going to change anything. And then there's also fear. There's a fear of that they'll get in trouble. They'll get in trouble for reporting on these risks that are in the workplace. I've had members tell me that they've been told not to put anything in documentation that says a patient is in a closet space, even if that patient is in a closet space in their workplace, because they're over capacity. So overcapacity is another, workplace hazard. So if you have patients that you're caring for in hallways or in closets and you're being told you're not allowed to document that that's where the patient is that you're caring for, how do we expect our members to take it seriously about reporting when they're given that kind of direction from their managers and the employer? Because reporting about that is important when we're going to, try to talk about increasing staff and increasing safety measures. We need to know what realistically is happening. And we need the reality as it is.
And how do we fix the issues if we're not reporting them? I know we've had to get involved and get Occupational Health and Safety involved in the hallway nursing. Because even you're putting your staff at risk and your patient at risk if you're trying, first of all, the dignity and the privacy and
your code of ethics.
Our code of ethics is being breached left, right, and center when it's happening. I can't even. But also the physical safety, because when you're trying to move a patient on a stretcher and you don't have
a lift, you don't have the support.
You don't have the support. I mean, there's no call bells.
Tripping hazards, and you might have a confused patient and you're out in the hallway and there's cords and there's other things that are externally there. And,
the point
being
is
told,
we need to document
you need to say
that.
what it is, document it as is. It's not a blame game. It's supposed to be, I know that, the employer is doing the best they can in terms of we don't have anywhere we're on overcapacity. We don't have anywhere to put these patients and they are sick and they need to be here. I get that. But denying that it's a reality is not going to help us move forward with solutions. So I think kind of changing that narrative among our members that, that if that is what you're dealing with, it's important to state that that's what you're dealing with. Because again, especially if it's affecting your ability to safely provide care, or the patient's at risk, or you're at risk because you can't get around and maneuver around to do what you need to do.
And each time we've got Occupational Health and Safety involved, they have made the recommendations that have to be implemented that do in fact improve safety and everything of the staff. Well, and subsequently the patients too in our care. So that connection between reporting and safety is so important. Me and you could talk about that for hours, but especially when we think about what we're hearing from our members on a daily basis. So in, recent episodes, we've been talking about this. We've been talking about violence. We've had guests here. We've talked about professional practice, the importance of reporting and that. So from an occupational health and safety perspective, how should nurses understand workplace violence?
Again, we talked about workplace violence at length when we had Todd Barron on the podcast. And it's heavily talked about in the media across the country really now. But when we look at it as a occupational health and safety risk, we need to think of it again, beyond the physical violence that everybody is usually quick to identify that as workplace violence, but often the psychological and the kind of harassment type workplace violence that people and members experience is not always lumped in as being a workplace violence issue. And I know the survey that went out to all healthcare providers in 2024 by NLHS. I think it came back, it was over 80% reported that they experienced workplace violence, either physical or psychological, in the past 12 months. So that's pretty significant. But what was more significant is that it was less than 40% reported it. Less than 40% reported that they're experiencing it. And I guess some of the getting at the understanding, we need to do better in understanding why it's not being reported. And I did ask those questions when we developed our annual member survey. So I'm currently analyzing the results, and we did ask the questions of, if you didn't report, why? And we're trying to get at that understanding, because we need to understand what we can do to remove the blame or guilt or whatever is associated with workplace violence that has made nurses and other healthcare providers believe that it's part of the job, because it is a rhetoric that we hear over and over again that, well, it's, it's something that we have to deal with. We have to deal with violence because, we're nurses, we're working in healthcare, we have confused patients, we have patients who are sick or unwell or, mentally, unstable. And so if they're going to become violent, then we just have to take it. And that is not true. No. That's not true.
We had to change that narrative even with the public.
Exactly. We need to report, and we need to let the proper channels investigate and decide whether anything needs to be done about it. But we can't just let it go on, because it's not part of a job, and it's leading to burnout, and it's affecting recruitment, and it's affecting retention. And it's an OH&S concern. We have a right, and we also have, again, the right to refuse unsafe work. But it's not just that, like, nothing can be done about it. That's the kind of message that we hear of, yes, I had a confused patient and, they punched me in the face. Or I had a dementia patient. I often hear that from members that work in long-term care, that they think they can't report or do anything about it because of the patient's condition. But it's not for them to decide what happens. No. That it's just for them to report that it's being done, because there are changes they can make, like such as increasing the staffing. That can improve the number of workplace violence incidents, because what all the research shows is that the more staffing that you have, the less incidents of workplace violence that are experienced in a workplace. Because think about it, patients are not going to be getting as frustrated when their needs are being met. So reporting it is not to blame a particular patient who may be unwell. It's to note that this is happening, and we're going to form a pattern now with this documentation that this is continuing to happen. And it has led to changes from OH&S in terms of, okay, now we have plexiglass put in places where we never had it, because we're noticing an increase in psychological and physical violence. Or we have security now where we didn't have security. We have locked facilities in rural areas that were never locked before. Those kinds of
ambassadors
changes.
in emergency rooms.
The ambassador program. There is changes that happen that we maybe as a union and as the employer side are not doing a good enough job at sharing those wins. But there are changes that come from complaints that are put forward to the OH&S committee that maybe our members are not really aware of. So there could be more and more changes if we reported the things that happened.
And I think we're seeing a higher incidence too of our members invoking their right to refuse unsafe work.
Exactly.
Because it used to always be, we'd hear from nurses about unsafe situations, and say it's working a 24-hour shift. I mean, if you looked at me and told me I had to do a 24-hour shift, I'd be like, no, bye. I'm out of here. I'm not safe. I'm not safe at the end of a 12-hour shift.
Yeah.
And I would not be safe to care for a patient and to critically think at hour 16, hour 20, hour 24. We tell people you have the right to refuse, because that's not only impacting your own physical health, that's impacting your patients. You cannot think as clearly at hour 16, 20, 24 as you do at hour 8 or 12. Yeah. So even those kinds of things, reporting them, and we do get involved as a union and help people and assist them with that right to refuse unsafe work. Listen, that whole process works.
Yeah.
And when the nurses and staff feel supported, not only by the union, but by the employer in this, it's a win-win for everyone. It's,
the important part is
safe,
following the right channels.
Yeah.
Yes, getting up and leaving your patient and I'm going to go home now without letting anybody know or going
Right.
to your manager. Obviously, that is not, something that we support, but there are proper channels. You have to ensure the safety of your patients that you're caring for, report to your immediate supervisor or manager, get in contact with the union and LRO, let them know this is what's happening, and wait for direction on how to proceed. If you go about it the right way, you are not going to be getting in trouble. Getting in trouble and, that I guess, common belief and the violence as part of a job, common belief, are really impacting our ability to move forward and improve the environment physically and psychologically for our members, because the underreporting that comes from those two beliefs, it's negatively affecting everybody. And it's a system issue. We have to remove everybody thinking that individually it's like going to, blame them or impact them, or it's about everybody. It's about our safety of all of us collectively, and all healthcare providers, as well as our patients and their families. Everyone has a right to be, safe when they enter into the workplace. So we need to report not just on, there's some old equipment that's broken in the hallway I tripped over. People have no problem reporting that as a hazard. But okay, there has been a patient that's been on our unit for the last month and a half that's been physically abusive to our members every time that they're providing care, or he's been psychologically, berating and, being very, difficult for our members, and they think that they have to put up with that as well. And they don't have to put up with that. So there are things that, as we spoke with Todd Barron, that they can do. And the same thing, family members being very challenging. People think they have to deal with it, but they don't. Then they can be removed from the premises. But if no one reports it or it's not known, then we're not going to see those changes. So we really need to drive home the reporting. And there are multiple avenues to report. Of course, there is the OH&S committee that these concerns can be brought to. But then you have your professional practice forms, and you also have your, incident reporting when things happen, and the peers reporting. And
we actually have a union rep on these occupational health and safety.
It's in our collective
committees.
agreement.
Yeah.
So I think kind of, improving our understanding of removing the blame, more knowledge is power, and we can work together to improve our environment.
I'd be remiss if I didn't talk about, the staff. You mentioned the staffing and how that impacts the work environment. We're currently coming into, the report on the core staffing review is coming out the end of April. The expectation is the Premier has promised that the recommendations will be implemented within 6 months. And as you said, the more staff we have, the less incidents of frustration amongst people, families, caregivers, loved ones, all of us as a collective. And that too will help to decrease the incidents. And NLHS, in partnership with Workplace NL, is also getting ready to release a violence awareness campaign for the public. As I've always said, every single person is entitled to a safe work environment. Every single person. You go to your workplace, and the expectation is that you come home whole. But that is not where we are to right now. And it's not just physical. It's that psychological impact. It's the psychological and moral distress even in nursing itself, around not being able to provide the care that we feel we need to give and according to our code of ethics and our standards. And you talked about hallway nursing. So if we are not reporting the issues and concerns around all of that, we're not going to make changes in the workplace. So if we take all of that and all of what we talked about, so we got the risks, we talked about the reporting, the systemic pressures in healthcare, the question becomes, where do we go from here? Ashley?
When we talk about where we go from here, it really comes down to two things. We need more advocacy and awareness related to occupational health and safety, but we need investment and system level investment from our government. We need support, infrastructure support. That's human resource related too. We need more nurses, and we need more of a commitment to safe staffing. Safe staffing saves. And we need to drive that home that together we are committed to doing what we can to reduce the extended shifts that nurses are working, the burnout, the fatigue, doing more to improve the physical environment. Overcapacity is common every single day. We're in overcapacity. We don't have enough beds, so we have our physical environment is impacted daily. We need more commitment to improving the infrastructure so that we can safely care for our patients. So we need to work together. From a union side, we need more reporting from our members. The employer needs more reporting, but we need provincially, the government needs to be really listening to us. We're going to go into collective bargaining now. They need to listen that this matters and that it trickles down. We need more reports to our OHS committee, but that means we need our members to raise their voice and voice their concerns, and we need the employer and the government to listen.
And I think one thing we're also missing is the education with the employer side too. A lot of new managers in the system. Not everyone is aware of the Occupational Health and Safety legislation, duty to report for nursing. It is our duty to report unsafe things, especially not just our own safety, but the safety of our patients, whatever impacts our patients. And we often say whatever impacts nursing impacts patient care and patient outcomes at the end of the day. So I think education is a big thing too, about the right to refuse unsafe work and the rights of workers in general when it comes to occupational health and safety.
And there's not just physical, it's also the psychological. But it's also other things in patients' environments that they have that can put nurses at risk. We do hear of members saying that, drug paraphernalia, these are all real concerns that members have and that they are seeing in the workplace. And they shouldn't be exposed to or have to put up with being exposed to, I guess, those things in the workplace. We need to put more measures in that they can, if they feel they're unsafe, like you said, we need to make sure they know that they have a right to refuse to care for a patient, to walk into an environment where those things are right in front of them and that they could injure themselves or put them at risk. So we need to really more education for our members, for the employer, for the public to support us and back us up that this is not acceptable. Violence is not part of the job. And it extends beyond the physical environment.
Absolutely. And I think if we look at society in general, increase in intimate partner violence, we're not immune to that in the workplace. That don't just happen in the home. That carries forward into our environment as well. So yeah, education for the public is very, very big in my opinion. So thanks so much for this, Ashley. This has been a very important conversation because at the end of the day, safety in healthcare doesn't happen by chance.
No.
It happens when systems are designed properly, when nurses are supported to not only just to speak up, but then to see what that information leads to. And it should be leading to action, like immediate action. We know that nurses are committed to providing expert care. Our nurses are there 24/7, 365 days a year. We're there in the system, and we deserve to work in environments that are safe, not only for themselves, but for their colleagues and for their patients. And that's something that we will continue to advocate for. You will continue to hear the Registered Nurses Union speaking out about violence in the workplace and what that actually means and what needs to happen, and that it is zero tolerance in the workplace, just like it's zero tolerance in any other workplace, in any other industry. So if you're experiencing safety concerns in your workplace, please continue to report. Connect with your union representative, your branch executives, your shop stewards for support, and you can pick up the phone and call our provincial office as well if you need some support around what it is to refuse unsafe work. Every nurse, every healthcare worker deserves to go to work knowing they are safe and that the system will support them when they speak up. At the end of the day, safe staffing, strong reporting systems, and proper investment in healthcare are all part of the same goal, making sure nurses can work safely and patients can receive safe care.
That's it for this episode of Scrubbed In and Speaking Out. Thanks for listening, and don't forget to follow or subscribe for more conversations about nursing, advocacy, and the future of public health care in Newfoundland and Labrador.